Innovation in Healthcare. I'm Lisa Oligas, and this is Newsmakers. In this edition, the Willcoxon Innovation in Health Sciences Summit. We will talk with organizers, a presenter, and a student about the opportunity to learn and share research done right here at the university. We begin our conversation with summit coordinators Melinda Brown, who is Department Chair for Healthcare Administration and Director of the Gibson Center for Healthcare Leadership, and summit presenter Dr. Crystal Lemons, who is MSSU's Dean of College of Health, Life Sciences, and Education. Ladies, thank you for being here on Newsmakers again.
Thank you for having us.
So it is very exciting. This is a big event. The summit is here at MSSU. I believe, is this the third one?
It's our third one.
That's pretty exciting. Let's talk about, there may be some people unaware of what this summit is. So talk about who can benefit from coming to this, the summit, and summarize kind of the mission of the summit, Linda.
The summit was made possible by the Willcoxons. They gave money to have the summit, and then also for our Willcoxon scholars, which we'll talk about later. And what this opportunity is for our community, for our students, whether they're high school students, college students, whether they're from another college, from also the medical school, so the dental school, students from there, the healthcare community, and just community members to come and learn about what is the innovation that's happening in health sciences.
It is a day full of great opportunities to learn. It begins with a keynote speaker this year. That is Dr. Mary Joy Garcia-Diaz speaking on the evolution of care through innovation. So tell us about this speaker.
So Dr. Garcia-Diaz, she is currently serving as the program director of nursing informatics, and she is going to bring to us a whole new concept, I think, for many of us. And it's really important because whenever you think about nursing informatics, think about the term informatic and think about information. We have so many ways that we can collect information on patients, and what we need to do is figure out how do we best utilize that. So when we think about how do we integrate our patient data with AI, for example, how does that make a patient, how does that help them to heal? How does that help them to have better patient outcomes? That is what nursing informatics actually does. So we can collect information about their history. We can have electronic patient records, for example, that can be shared in multiple venues. We can translate that to telehealth or virtual health care, which is increasingly important in this day and age, especially for patient access. We can monitor them. We can think about their blood pressure, their heart rate. We have remote monitoring in many cases, for example, like a heart monitor that might monitor EKGs. And that's just a sample of a lot of the things that we think about for nursing informatics. But how do we take all of that information and how do we make it usable? That's where the data analytics comes in. That's where the informatics comes in.
I do find it interesting, we get asked in the doctor's office sometimes the same questions over and over, which you think you should have that information, right? Because you often fill out your profile online. So from the personal experience of the patient, should this speed up appointments? I know nowadays you can even get your results, sometimes even before your provider gets them, which does that kind of lead to misinterpretation? What are the pros and cons of all that?
So you're exactly right. In terms of speed, whenever we have electronic patient records, that is something that the patient can often access even before the provider. We do have to be careful. There are some negative things that can happen with that. We would not want a patient to misinterpret their results. But on the other hand, the things that we can do once we have that data is fully integrate that. And so we can use AI to help us do predictive modeling. So, for example, if we know maybe your background, your lifestyle, the medications that you're on, the results of these tests, whatever it is that we have, we can do a better job predicting, this patient is most likely to develop this disease or this condition within the next 5 years. How can we maybe intervene sooner rather than later? Or maybe this patient is most likely to respond best to this treatment and not this treatment, even though you may have more than one treatment option that's totally viable. Again, it's using that tailor-made specific for that patient, integrating all of that data.
Yeah.
And
Dr. Garcia-Diaz at Presbyterian Hospital in New York. Yes. She is with nursing informatics. How do you think this benefits our nursing students to hear from someone in this position?
I think it's tremendous. She is going to bring a whole pathway that a nursing student can take in terms of their career. She is going to help elevate their level of understanding of the different opportunities they can have as part of their nursing career, really illustrate the connection that is imperative between data analytics and patient care. We have to bridge the gaps because that's where medicine is heading. And so somebody with her background and her expertise can expose our nursing students to that to a much greater degree, help prepare them for some of their workplace environments as they're going to go out and work.
Awesome. So another presenter, which I find this really exciting, is presenting a session on wearable technology. And this is Dr. Yayan Du. So tell us, Doctor, you comes from a medical engineering background, and it's kind of odd. You sit there thinking the session's going to be called From Benchtop to Bedside, Translating Wearable Technologies into Real-World Healthcare. So how common is wearable technology? Give us some examples that the average person might understand.
Sure. So wearables these days, and I'm going to kind of stick to healthcare wearables, but it's becoming increasingly common. This is just an estimate, but approximately 1 out of 3 Americans are using some type of healthcare wearable.
Wow.
Which is quite good. We do see some differences, though, in the age distribution. We know that persons, like under 50 tend to utilize the wearable technology a little more than, say, people that are 65 or older. And that can be a little bit problematic because as we get older, we may be more apt to developing conditions that really could utilize, or, our own patient health could be enhanced if we would utilize wearable technology.
So give me an example. Would be like a diabetic pump? Is that
Sure.
something that's wearable technology?
It is, or even I'm going to say a glucometer, a little device that's going to measure your blood glucose and translate that to an app where you can see real time what your body is doing throughout the day.
So you know how to eat.
Yeah, so we know how to eat, we know how and when to administer the right level of medication, for example. That's critical, especially for patient outcomes. So that's one example. We also have wearables that can detect and monitor even things like an EKG, like the electrical activity of your heart, plus heart rate, blood pressure, all of those things. Sleep monitors can actually be wearable technology now.
Amazing.
Yeah.
So she's worked even in automotive engineering. How does this show the importance of collaboration when you think about people who work in maybe one field and yet making this apply to the medical field?
So we see this all the time, and especially in the area of research. Dr. Du is a great example of that. So she has a PhD and a master's in mechanical engineering, and that is critical because think about the devices that are having to be engineered.
Right.
So all of the things that have to go into constructing a device, there's computer, there's electrical, there's the mechanical, all of the things that are part of that. And especially in the world of research where we see the development take place of these devices, you have to have people that have diverse backgrounds that come together. It's generally a team. You might have a computer engineer, you might have an electrical engineer, you would have a mechanical engineer, you might have a biomechanical engineer. All of those individuals will be part of a team in order to produce something like a wearable.
Wow,
device.
exciting. Well, so you yourself are going to be talking about our Blunt Innovation Health Sciences Innovation Center. Dr. Lemons, you're speaking about that. What do you hope people will learn about what work will be happening in the Blunt Center? And I mean, also talking about developing things, we have the 3D printing center. So tell us what things you are excited to share with the community here.
There are so many things, but I think what I would say first and foremost is that we do have a layout, a structure that will mimic a hospital. And so that is critical. We certainly don't have that here now. And so it really elevates our education for our students when they can go into a simulated operating room, for example, or simulated ER, triage, labor delivery. There are so many different ways that we can utilize that. We can do simulated learning with sophisticated mannequins that can be set up for any scenario, that can talk to our students, that can do physiological functions. For example, they can express pain, they can sweat, they can cry, all kinds of things. The level of sophistication
Amazing.
for the mannequins is just amazing. But beyond that, a hospital setting like that really allows different healthcare students coming from different areas, like respiratory therapy, for example, radiology technology, nursing students. They can interact as a team, which is how it really is out in the real world. You know, they're going to work as part of a team, and that enhanced interprofessional learning is critical.
That's awesome. So this year's event will feature a panel discussing rural healthcare needs. Melinda, why did we want to have a panel that talks about this? And it's local professionals.
Exactly. We're super excited to have these professionals come. They're healthcare professionals that work in the rural communities every day in their job. And so there are many challenges to rural health right now. And so we're going to be able to sit down and talk, you know, we have someone who's coming from one of the tribes. We have someone coming from, 2 people coming from local hospitals. And then we have someone from Access Family coming to talk about, you know, the folks that are the less fortunate, you know, and healthcare is very important to them and their families. But just bringing all of them together to talk about what are the challenges and how can we work together.
Yeah, I mean, a lot of times we've always heard that if you don't do some preventative medicine, maybe at the clinic level, they may end up in a hospital ER, and of course that impacts the cost of medicine. What are some of the primary concerns about access to health care that still exist?
Just the physicians, having enough physicians for our area, whether it's in the cardiac area or for a patient who doesn't have transportation to get to that physician. You know, they may live out in a rural community and they're not able to have that transportation to get to see a physician. So telemedicine helps with that. And some of our area physicians do the telemedicine side of it to help those.
So let's talk about how this benefits them. Some can actually get learning credit or education credits. Talk about that.
So we are going to offer continuing education credits, 3.5 for our respiratory therapists, for our radiology area. So anyone that's in respiratory or radiology, these are free continuing educations to come to the summit. You'll get breakfast, you'll get lunch, and it'll just be great because it's free and it's local here.
That's awesome. So registration is underway. Tell us what people need to do, because you said it is a free event open to the public, but you do want people to sign up. Tell us why.
We need you to go to www.mssu.edu, Willcoxon Summit, and you're able to RSVP there. Please do it by March 20th. So we will have plenty of space and food for everyone. So if they could just do it by March 20th, we would appreciate it.
And it's pretty much a day full of interactive sessions, events. So they want to spend the day here.
Right.
For the most learning.
Yes, you'll want to not miss any of the sessions. They're going to be great information, and it's going to be great to have the community together, whether you're healthcare students, to have that interaction with each other.
Talk to us briefly about the Willcoxon Scholar Program. We're going to talk with one of the scholars next. Why was it important that this be a component of the summit?
I think this is very important. For one, the Willcoxons, they're just generous people that gave to these students. They're able to go to college because of people like the Willcoxons, and us to see what their research is. What are they talking about at lunch? There's 5 of them. They'll be able to get up and talk about what their research is, and then after the lunch, you'll be able to walk around and look at their different research and talk with them to see what they're working on in innovation.
They're the future of our healthcare.
They are.
Yeah. All right. Well, Melinda Brown, Dr. Crystal Lemons, thank you for sharing all this great information about the Willcoxon Summit.
Thank you.
My pleasure. Thank you.
We're going to take a break, and when we come back, we hear from a student about her research. We'll be back.
Every new day at Missouri Southern State University opens the door to meaningful opportunities.
Immersive learning, health and life sciences, global education.
These 3 pillars form the foundation of our mission.
I've always learned best by doing. When I could shape ideas with my own hands, everything clicked.
I enjoy helping others, but I never considered what it could look like as a career.
I grew up in a rural area where people rarely traveled abroad, and I always wondered what waited beyond my small town.
Here I discovered what I can do and who I can become.
Seeing the world through unique perspectives has reshaped how I view my place in it.
At Missouri Southern, we grow and change with purpose.
And that growth shapes who we become.
What begins on this campus moves into studios, hospitals, conference rooms, and communities across the state and around the globe.
This is Missouri Southern State University. Explore boldly.
Care deeply.
Impact globally.
One expanded mission,
Built with lion pride.
Welcome back to Newsmakers, where we're discussing the Willcoxon Innovation in Health Sciences Summit. Experts in the world of medicine will present sessions, but it's also an opportunity for our students to share their research and get feedback. Joining our conversation now is student Mai Dorgam to talk about her summit experience. Welcome to Newsmakers.
Hi, thank you for inviting me.
You're welcome. We're so glad you're here. Before we dive into the summit part of things, tell us what you are studying here at MSSU.
So I'm currently a pre-medical, in the pre-medical track here at Southern. I'm majoring in biomedical science, and I'm part of MKeep here at MSSU. I'm like a third year, so I'm graduating this spring.
This spring already,
Yeah.
Wow. Okay, so you are a Willcoxon Scholar. What does that title carry with it? How do you become a Willcoxon Scholar?
So I'm very grateful to be a Willcoxon Scholar, of course. I think that title carries a lot of honor because they really get to they get to talk about, they show you how you're achieving academically and how you're involved in research, and they honor that about a student. And it does come with responsibilities of course, representing both the program and MSSU through professionalism and leadership and of course academic contribution.
All right, so let's talk about, lots of people enter the medical world for various reasons. You said you actually started out wanting to be a dermatologist.
Yeah.
So what was your path to where you are now? What medicine and what you're studying now is the eye. How did you get from dermatology to there?
Yeah, of course. In high school, it was the first time I was oh, I really want to be a dermatologist. I noticed a lot of people were talking about acne, sunscreen on the internet, and that really got me interested in that specialty. But then when I first came here to Southern, I saw the cadaver lab, and I would like to say that I basically fell in love with it. I would always try to be as involved as possible. I used to visit the human dissection class and just observe a lot. And then I went up to Dr. Berry and I asked her, and she offered this research opportunity, and that was my first time really seeing the nerves and the eye. I got to get a lot of skills and knowledge about just neuroanatomy, perform craniotomies, which is something that I thought I would never do. And so then while dissecting, I really started falling in love with the nerves and the nervous system in general, and it really made me want to pursue more into the neurological field now.
Wow, that's, because it's a deep area of study.
Yeah.
It's kind of, hard for maybe the average person to understand what you can do. So the program requires you to have a mentor. Who is your mentor?
Dr. Berry.
Dr. Berry.
Yeah.
So are you excited that you're going to graduate, but they're going to have this expanded cadaver lab? But it's a pretty great cadaver lab that we have now. What do you enjoy about that? Is it being able to see the body from every angle, or?
Yeah, of course. It's like such like a hands-on experience that I believe you can never get anywhere else, like not in a classroom setting. You can never get this much knowledge and skills. It's like, and also like being able to work in like such a collaborative environment with other people is something that's like very helpful, because you get to learn a lot about other people's perspective. You see people's like strengths and weaknesses in like dissection, and you get to learn from them, like learning how to like pay attention to certain details. They teach you how to dissect a certain structure. And it's like, it just like really is such a great opportunity. Like a lot of even medical schools don't really have that. So being able to have that in the undergraduate years is something that's invaluable. And I am really excited for like the expanded cadaver lab. I'm kind of jealous that I wouldn't get to experience it because I'm graduating. But I feel like for students that are like pursuing any health like care careers in the future, it's such an invaluable experience. And I would definitely tell them to like go and like participate in it and be involved in it as much as possible.
Yeah. So how does being the Willcoxon Scholar impact your research in what you're doing? Does it give you like extra time, or it helps fund your, it's like a scholarship?
Yeah, so it definitely helped a lot. It gave us funding that helps us like do our research, because part of our research requires histological sampling. It's like we dissect the nerves from the eye and then we send them out, and we that produces histology slides that's just actually what we analyze. So the program and the scholarship definitely funds that part, and without it we wouldn't have been able to do our project.
So I know you said you're talking about the eyes, but it's really, when you look at your summary of your research, if you're not in the medical field, you might understand it. So tell us about your research. It has to do with orbital sympathetic innervation. So for those of us not in the medical world, what does that mean? What are you studying about the eye?
Yeah. So the title of the project is Identifying the Origin and the Presence of Catecholaminergic Fibers in the Cranial Nerves of the Eye Orbit, which I know is long. So catecholaminergic fibers are those like sympathetic parts of like the nerves in the human body, and they're responsible for like stressful events such as like the fight or flight mode is like what it's mostly commonly known as. And so what we're doing is we're identifying where these like fibers originate in the eye and how consistent they travel within or alongside these like cranial nerves within the eye. And we hope it would like really help in better understanding like neuroanatomy.
So are there certain diseases of the eye that might be impacted by your research?
Yeah, so we believe that our research really helps like map like where these like fibers are found within the cranial nerves, and that will really help with like healthcare providers, like such as surgeons when they're operating, and just physicians normally, because it gives them like understanding of neuroanatomy that makes them understand how these like the specific lesions and what like how they're anatomically composed. And there's certain like diseases out there that don't have a cure, like ophthalmological diseases, such as there's an example is that Horner's syndrome. And so the problem with Horner's syndrome is they don't really know like there's like differences in what lesions can be impacted. So by being able to really contribute to a better anatomical understanding of like the eye and the nerves inside, we'd be able to give them some more information about these lesions, so then they can develop like therapeutic discoveries for it in the future, hopefully.
So there's no cure for Horner's right now, but so tell us, I mean, what would happen if you had Horner's? I mean, how would it impact someone? I mean, does it cause blindness, or does it just affect the quality of your vision?
Yeah, it affects the quality of the vision. It also affects like the eye movement in general. They have impaired like pupil size, like the abnormal pupil control, eyelid movement as well, tear production. So it affects a lot of like the different structures of the eye, and it makes like abnormal functioning.
Yeah, I mean, if someone had that, it would certainly be debilitating if it affected every day of your life. So great research then. You have to do a presentation. Are you scared?
A little. Yeah, so hopefully in the summit I'll present a poster that walks through like the methodology of my project, as well as like the anatomical patterns we've observed and how these can really be used in a clinical setting to help better refine the understanding of neuroanatomy.
So when you make this presentation, what will you be telling everyone? I mean, what all do you include, and how do you explain to someone who, I mean, most of the people there will be medically based, so they'll have a better understanding. But how long will your presentation be? So we first start the summit by just having like a 1 minute, one slide
summary of our presentation, kind of to get people really interested in what we're talking about. And then we stand beside our posters, which have all of the information about it, more in detail about what we did and how we did everything and what our findings were, like statistical analysis and everything, and then also how these contribute later to like in the clinical and the healthcare scene, and also how future investigations might help expand on this topic. And so people can just come over and talk as much as they want. They can read the poster, ask questions.
Yeah. How do you hope people will benefit from what you're sharing when it comes to this research? Or how do you hope maybe by sharing it, it can even impact your research?
Yeah. So by sharing my research, I do hope that it definitely helped healthcare providers gain a better understanding of the anatomy of and how these cranial these fibers are located in the cranial nerves of the eye, which will hopefully help better patient outcome in the future, better treatment as people get to understand. And then also when surgeons are operating, they get to really work with these really dense structures in the eye orbit. It's such a delicate structure, so having this better understanding of it will really help them make better informed decisions during procedures, and also it reduces just overall complications that might happen due to unintended nerve damage.
Yeah, it just seems to be a very sensitive area to even ever operate on. You know, when you think about the eye.
Yeah.
So Dr. Lemons will be talking about the Blunt Health Science Innovation Center at the event, and it is a simulation hospital, the expanded cadaver lab. How do you think that helps students like yourself when we have this Blunt facility? I know you don't get to use it, but what do you think that it offers most to students?
I think it offers a lot of knowledge that you don't gain in the classroom setting about the medical field, anatomy, human body. It helps them definitely a lot, and I feel like it doesn't just help them in that aspect of gaining knowledge and skills, but it helps them understand more about themselves, either what they would love to pursue in the future. For me, when I got into this research, I realized, oh, this is something that I would really like to pursue. But so I feel like these are very valuable experiences for students that helps them really make a decision about their future careers.
Immersive learning puts you to test know, oh, will I like doing this the rest of my life?
Yeah.
Well, Mai, thank you so much for sharing your research, and good luck to you in your presentation at the summit.
Thank you for inviting me.
You're welcome. That wraps up this edition of Newsmakers. We hope all feel welcome to attend the Willcoxon Health Summit. Check out the session schedule at mssu.edu and click on the Willcoxon links. Thanks to our guests, and thank you for watching Newsmakers.